Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, and this is another video of mine. We've had quite a few over the last few days.
Yes, we've got a few coming up.
Now, yeah, you can see consistency on this one is
Odd.
another strange one. So, to start with, I thought this was going to be a very, very sort of gloopy, like sticky one. But you can almost kind of, it is sticky, but it's also, the surface has almost got this kind of harder, thin layer to it. They're really, really strange one, this one.
It's almost like this sort of like a skin of custard, isn't it?
Yeah, yeah. Now, you can almost just, you can see like a lot of, now that we started peeling that, or like breaking away that kind of harder section, you can see underneath we've got a much wetter sort of consistency. Now we're just peeling away that drier section.
I've seen this with, if patients use treatment for things like outer ear infections, like Optimize and stuff like that, sometimes you see that thicker, hardened up surface layer to it, don't you?
And I think that's literally what we've had with this particular patient. So has been, you know, treating a recent outer ear infection, but obviously hadn't had the wax or the debris, or, you know, sometimes you can get a lot of discharge building up in the ears. It's better to have that removed first rather than starting your treatment when the ears are completely full, because it's not really going to work to its full potential.
Yeah, we see that a lot, don't we? So it's whether you remove the infection, which is going to aid with your treatment, because it means that it can actually work on the infected area rather than sitting on top of the infected debris that's there, really.
Yeah, and you can just see how dry it's basically just solidified this sort of outer portion. I can't get my words out.
It's like a sort of, when you think of like lava at a volcano, like you get that sort of surface crust, and underneath it's all quite liquid. So magma.
Oh yeah, that's good explanation.
Lost in powder, magma.
Magma.
So it's coming away.
Yeah, you can see it peeling now. Now you can just see how pink and how inflamed that skin is underneath this.
It's not. It's definitely not an easy thing to do. This one. It's not. It's a tough old removal to do, because there's such different consistencies, and that layer then becomes super thin. That crust on the canal wall becomes really, really thin.
And I personally find them quite tricky. I know we've done quite a few of them, but I find it really tricky because, again, when they're really dry like this, you know, you almost kind of have to touch up against, well, you have to touch up against it to try and peel it off, which again can sometimes be quite uncomfortable. Now look at this here. We've got really lucky here. I didn't actually realize this was all going to come away in one big piece.
Wow, look at that.
That looked like a really wet, soggy sort of, like, I don't know, I thought that was going to be almost liquid.
Yeah.
But it was we got quite lucky there and got a big piece that had come away.
That's another one you want to do before lunch, is that one, really? Yeah,
you normally get some odours coming from these.
It's quite a pungent. I can smell it now. Yeah. It's a really pungent, kind of quite strong smell. Most of the time it does, because that's one of the questions that does come up with, is does wax smell? It doesn't really. In the majority of the time, I'd say the worst I've ever smelled just purely wax without infection would be that kind of dirty hair smell.
Yeah. And you can see
that is
how
inflamed.
That is, yeah. You can see just how much of that wet material we took away. Quite tricky as well, very bendy near the eardrum there. So we've already been lucky to remove as much as we have now. So I'm just trying to tidy up these last little bits. Now, normally, either during or always following the procedure, I would have normally, or obviously Rhys would have as well, we would have referred this patient back to the GP, because there's obviously still, you know, there's, whether or not it's just that debris that's been sat there for a little while has caused this kind of inflammation on the ear canal. But, you know, to be on the safe side, we'll always refer them back to the GP just to get their opinion, medical opinion.
Still not healthy, is it? Because you can see just out. I mean, you can't really. We can make out the eardrum on there, because obviously that's what we're used to looking at. But you wouldn't be able to make out an eardrum normally looking at that. It's so puffy and so inflamed all the way around it. It just all merges into one structure, doesn't it, down there? Yeah. Don't forget, guys, the reason we have to refer back to the GP is because in the UK, audiologists are not classed as medical; we're classed as technical, which means that we can't officially diagnose. We can suggest, but it has to come from a medical professional as a diagnosis. So when you're looking at prescribing antibiotics, that's something currently we cannot do here in the UK. It has to go back to a medical professional to do that. There is talk of changing that, but it's not coming yet. Yeah, that is very inflamed.
Not a very healthy looking eardrum there, but
definitely not.
Yeah, definite referral back to the GP there.
They both went different ways there. You must be doing centimetres, I must be doing inches, because that's on my side.
1.5 centimetres, roughly?
Half an inch. There we go, half an inch. Well, thank you very much for watching our video today, guys. And as always, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and the amazing Mr. Taylor Green. We'll see you again real soon. Bye, everyone.
Bye.